lower back and hip flow today.
Start with posture, or connection, posture and breath as usual. Okay, so lie on your backs and we're just going to think about the connection of our bodies between our bodies and the floor, and where we should be feeling the connection is underneath each foot. We want to feel that symmetrically both sides, underneath the the lumbosacral junction, underneath the TL junction, underneath both shoulder blades and underneath the back of the head. So we're just going to work on a few postural movements now, or postural cues, to try and help you feel better connected with the floor. So let's just think about our feet. Think about if you can feel it more, the floor more under one side than the other, or if it feels equal. If it doesn't feel equal, try and just shift the weight a little bit more so that it does feel equal. And then you want to feel the weight equally from the medial side of the foot to the lateral side of the foot, and then front to back. So if you're feeling like the weight is more on the outside of the foot, try and pull the foot down so that you can feel it more on the inside of the foot, or equally if you feel it more on the inside, try and just distribute that weight a little bit more evenly. And then we're going to think about the pelvis. So if we try and peel the spine away from the floor and then reverse peel it so that it's pressing down into the floor, this is called a pelvic rock or a pelvic tilt. So we're going into an anterior tilt when we peel the spine away, and a posterior tilt when we're reverse peeling into the floor. And we're just going to alternate between reverse peeling and peeling our spines off the floor, so alternating between anterior and posterior pelvic tilt. And we just want to try and finish in a neutral spine, so where your back is flat on the floor. So you don't want there to be any kind of a gap between your back and the floor, but you don't want your back to be caved into the floor either. So no gap underneath here. And that should get a better connection now between your lumbosacral junction and the floor, so the junction between your lower back and your pelvis. And then you want to work your way up to your TL junction. So what you want is for your ribs, your rib cage and your pelvis to be in alignment with each other. So they want to be parallel. So think of your pelvis and your rib cage like the pages of a book. So what we don't want is for the pages to be open. So that would be where there's this rib flaring, this gap underneath the spine and the floor. So what we want is for the pages of the book to be closed. So you're going to try and pull the rib cage, pages of the rib cage towards the pelvis so that they're in alignment. So you go from being flared through here and pull that down into connection with the pelvis. And that should feel now a much better connection between your TL junction and the floor, which is the junction between your upper and your lower back. And then you want to think about your shoulders and the floor. So again, they want to be symmetrical, both sides. You want to feel it equally from both side to side. And then you want to think about your shoulders. So they don't want to be pushed forwards or up by your ears. We're going to get them into a more neutral position, we're going to think about externally rotating and depressing the shoulder blades. So we want to take the shoulder, when I say depress, you want to pull the shoulder blades down towards the back pocket on the same side. What you don't want to do is pull the shoulder blades into the floor, so into retraction. It's an external rotation and depression. So you're using these muscles at the back and down underneath the shoulder as well. So pulling down and externally rotating. Okay, so they should be in a more neutral position now. And now you're going to think about the head. So your head wants to be pushing down towards the floor. You're going to keep looking up towards the ceiling. So you don't want your neck to extend, so you don't want it to go backwards like this, and you don't want it to come forwards. So you're going to push it straight back towards the floor, looking straight up towards the ceiling, and you should then feel these muscles at the front of the neck sort of activate or start to work a bit more than they were. So they're called your deep neck flexors. So now we've got better connection, or we should do, so underneath both feet equally, underneath the lumbosacral junction, TL junction, both shoulder blades and the back of the head. And you should feel it at the back of the arms as well. If your arms are down on the floor, you'll be feeling it at the back of the arms. I usually just rest my hands on my tummy when I'm doing my breathing. So now we're going to think about the breathing, and first of all we just want to get your breath in the right order. So to do that, put one hand on your chest, one hand on your tummy, and we're just going to think about the breath as when we take a breath in, it's the hand on the tummy that wants to lift, and when you take a breath out, the hand on the tummy wants to lower. The hand on the chest doesn't want to move anywhere. So what we're trying to do is just get your diaphragm working a bit better. So when you take a breath in, your diaphragm should go down towards your pelvis, and then that should create this lift in the abdomen. So if you're not breathing down here and it's all coming up here, it's just a sign that your diaphragm's not working as it should be naturally. So we're just going to try and retrain that now. So think about your breath going into this hand on the tummy. So really try and focus on your breath. Try not to think about any of your worries. Try and let those just drift away. So focusing, think about the hand on the tummy lifting as you breathe in, and lowering as you breathe out. Let's do a couple more. If you're struggling with this, just try and keep practicing, even when you're not doing these flows. Just, practice it day to day. The more you practice in sort of general everyday life, the more subconscious it'll become, and it'll get easier and easier, and then you won't have to even think about it. So now we've got the breath in the right order. Just put your hands around your waist, because what we want to do now is we're going to try and create, we've got the diaphragm working a bit better, but now we want it to work the whole way, the whole of it wants to be working properly. So I call it a 360-degree breath. So we want to feel all the muscles in the abdomen activate, or trying to push your hands away as you're trying to breathe in. So what we want to do is grab hold of the waist, so around these bony bits at the front, so grab hold with your fingers, whether the hand goes around the waist, and then thumbs want to grab hold of the back. And you want to feel all those muscles try and expand and lift into your hands, so the whole way around, so front, sides, into the back. So if you're struggling to feel those muscles, if you just cough, so grab hold and then cough, feel the muscles wake up, so that kind of lets your brain know where they are. And now when you take your breath in, you want to think about all those muscles. lifting, and it should feel equal from front to back and from side to side. But if you're struggling in one area, so let's just focus on one area first. So think about the front bit first. Just visualise those muscles at the front lifting. Breathe in through your nose, breathe out through your mouth, through pursed lips, and just imagine that you're blowing through a straw. You can feel those muscles lifting, so think about the side bits now. So think about those muscles at the side pushing outwards. And now put your thumbs into your back, and you're probably going to need to cough again to wake them up. Feel those muscles. And now think about those muscles in the back, trying to push your thumbs towards the floor. At the same time, think about your pelvic floor and what your pelvic floor is doing. So as you're breathing in, your diaphragm and your pelvic floor should mimic each other. So as your diaphragm goes down, pelvic floor goes in the same direction. So your pelvic floor is being pushed towards your feet. Let's do a couple more breaths. And now we've got that 360-degree breath. We want to be able to create a brace and a brace breathe. So sort of day to day, you just want to be able to breathe 360 degrees, creating that 360 degrees of intra-abdominal pressure. But then when you're doing things that need a bit more stabilisation, so when you're lifting weights or like I said before, carrying the shopping or picking the kids up, you need to be able to create a bit more stabilisation. So you need to be able to create a brace and keep breathing through it. So it's an outward push, it's not a clench or a tense, or it's not sucking the tummy button in. So you want to create that 360 degrees of breath. And then before you take your breath out, you're going to do an outward push, which the cue I use is to imagine that you're farting. So it's an outward push. So breathe in, outward push, like pretending that you're farting, and then keep those muscles active as you breathe out. Breathe in, keep active as you breathe out. So try not to let the muscles completely back away from the hands as you're breathing out. Do a couple more of these. Okay, so throughout the flow, you're going to practice this breathing, practice your 360 degree breath, and then practice when you need a little bit more stability, when something's a bit more challenging, you're going to need to be able to brace, so that outward push. So we're just going to put our feet and our knees together, and we're just going to do some shoulder bridges first. So we're going to keep starting in the neutral position, and we're just going to reverse peel the spine into the floor and try and lift your spine using your bum muscles off the floor, vertebrae by vertebrae, so that you finish up with your body in this sort of straight line if possible. So you don't want to sort of end here, but then you don't want to overshoot and go too far. So you're using your bum muscles to lift and then come down again, so you're peeling your spine into the floor again, into the neutral position, and then reverse peel again, lifting vertebrae by vertebrae, mobilising the spine, and then back down. And again, so peel. And back down. Try and squeeze the knees together as you're going up. Back down. So really trying to mobilise the spine. And lift. And lower. Just do 2 more. Keep breathing. One more. And then go back down. I take the feet a little bit wider so they're at hip distance, and we're just gonna float one leg up into the air and then down and lift the other down. Just doing alternating legs at first. So this movement is just coming from the hip at the moment, so we don't want any movement happening through the pelvis or the spine. And now we're going to lift both legs, so you want to create your 360-degree breath, create your outward push and lift the legs. So what we want to try and avoid when you're lifting is this anterior tilt. So we don't want the pelvis to tilt and the lower back to leave neutral. So the movement is just coming from the hip again. So we're lifting and lowering. So keep lifting and lowering. And then hold it at the top. So we're in this 3-month supine position. So feet want to be in a neutral position, so they're not turned inwards or outwards, and they want to be slightly pulled up towards your head, but not too much. You want your feet higher than your knees over your hips, so about 90-degree hip flexion, and then external rotation in the hip, so they're not too close together. So we're just going to hold this position now, and we're going to really think about the breath, and think about the breath going into the lower back. So if you need to, grab hold of your waist, try not to let your shoulders pull forwards, grab hold of your waist, get the thumbs into the back, think about those muscles expanding into those back muscles, the breath expanding into the back muscles. And the back muscles trying to push your thumbs, if you're grabbing hold of them, into the floor, but without curving your spine. So you're not just pushing your back into the floor, the muscles are expanding into the floor. if you're struggling to hold this position with both legs in the air, just lower one leg down and hold the other leg. Or you can put your feet onto a chair or onto a ball so you can rest your feet. What we don't want you to be doing is tensing, so over recruiting the muscles in the front of the tummy. So if you're starting to shake and tense, you probably need to either put one foot on the floor or you need to put your feet onto a chair or a ball, and then just sort of spend a bit of time supported and then lift for as long as you can without letting your abdominals sort of take over and start shaking again. So you should be able to hold this quite comfortably. Really thinking about that breath into the back. Let's do a couple more breaths. Bring your knees into your chest. Just roll side to side. Give your hip flexors a little rest. And then take your legs back into 3-month supine. And we're just going to do some hip abduction. So we're going to take one hip out to the side. So this is a controlled movement coming from the hip. And take the other leg out to the side. So really make sure that you're not just, your body's not coming with you. So this wants to be nice and controlled through here, and the movement is a controlled movement coming from the hip itself. And then if you start to draw some circles with your hip, so taking the hip out to the side and then pull it back in, again nice and controlled. Getting that rotation in the hip. So don't just make this movement with the knee and the foot, like I see a lot of people do. You actually want to make that movement come from the hip. So do the opposite side. And you're going to do both directions with both hips. Want the movement to be smooth, so if going wider you start, like your movement becomes a bit jaggedy, just make it a really small movement. Got to do the other side, the other direction, so I'm going to do that now. Keep breathing into the back. More. Pull your legs in again, give your hips a rest. And then we're going to either grab hold of the feet with the hands, or if you can't grab hold of the feet with the hands, get your band, put it around your feet. So we want the feet to be a bit higher up this time. So sort of point it up towards the ceiling, and you're getting more hip flexion. So I'm grab hold with my hands, and again we're just going to hold this position, thinking about the breath, entering the abdomen 360 degrees, and particularly trying to focus on the back. Feel your back muscles press into the floor. Do a couple more breaths. And now, keeping hold of the feet, if you can, we're going to roll onto one side, and then, oh, I've got enough control today, and then roll back. So create a 360 degree breath, and then look one way, and we're just going to roll and come back. If you can't do it holding onto your feet, just let go of your feet, and we're just going to roll from side to side. So we want the body to come as one, so don't let your pelvis and then shoulders come, or shoulders then pelvis. Imagine you've got your Lego body and your body is coming at the same time, and you're controlling it down, so you're not just letting yourself flop down. And then your spine wants to be straight when you're on your side, so you've got a bit of a gap here, and then roll back and roll the other way. Again, if you're struggling doing this without your body disconnecting, or you lose control, if you've got a gym ball, put it between your knees and your hands and squeeze it together as you're going from side to side. And reach as if you're reaching for something with the top hand. Let's do one more each side. And then we're going to just go up into our lower oblique sit, and we're going to do some hip folds now. So down in this lower oblique sit, so you want your forearm and hand flat on the floor, shoulder active, so you're going to pull the shoulder into that external rotation and depression, so the shoulder's not pulled forwards or up here. Don't let your spine collapse, so keep it nice and straight through here, and we're just going to fold on the hip. And then externally rotate and fold. So really trying to feel that movement in the hip. As you externally rotating, you're going to push your knee down into the floor using your bum. Do a couple more. Last one down in lower oblique sit, and then you're going to push yourself up into high oblique sit. So again, shoulder active, spine nice and straight, and again you're going to rotate round, folding on your hip. Let's do a couple more. Keep breathing as well, focusing on that breath down into your abdomen, round into your back. And now we're going to come up. We're going to put the arms up into the air. Try and be nice and upright through here. Try not to let yourself sag. So as upright as you can. And then we're going to do some hip rotation. So we're going to pull the knees up to the ceiling. When you're in this middle position, you want to make sure that you've got a nice straight back so you're not sagging. And then we're going to roll to the other direction. And come back here. And we're just really focusing on that movement in the hips. So as one hip internally rotates, the other externally rotates. I always move forward when I do this one. So your hip movement and hip rotation and flexion, and you need good healthy hips to have a good healthy spine. So the amount of movement or the amount of mobility you've got in your hips can directly influence what goes on in your back. So if you've not got enough movement in your hips, your lower back can sort of has to do all the work when you do things like sitting to standing, standing to sitting. So you really need to help working to improve your hip health. So this little exercise is a really nice one to try and improve your internal and external rotation in the hips. And just do one more over to the other side. And then we're going to be doing the right side now. So down into your lower oblique sit, shoulder active, and we're going to fold. Fold. Keep pushing into the floor as you're externally rotating the hip. One more in lower oblique sit, and then come up into high, and again we're folding. Do a couple more. Okay, now we're going to come up into this tall oblique sit again, and we're going to take the legs up into the air again, into your tall sit. I'm going to turn this way, and we're just going to rock from side to side. And then we're just going to lean to one side, hand and knee down, and turn over into quadruped, and then you're just going to go the opposite way. So we're going to finish now in this high oblique sit, and then come round and over, so you can see me. So the right foot is in front of the left foot, down and round, down, round. Try and make the body come as one. Again, you've got your Lego body. Just keep alternating sides. And then finish up in bear, down to quadruped, and turn around this way now. Down into low quadruped, sit back on the backs of the legs, and then put your hands, head on the floor, hands around the waist, and we're just going to focus on our breath again. Think about it expanding into your back. Now come up into your low quadruped. So forearms flat on the floor, tilt your pelvis backwards and forwards, find your neutral spine again, so the midpoint, so you're not flexed and you're not arched here. And then we also want to think about our upper back, so a lot of people spend a bit too long in this slouch position and they get a bit fixed in that position. So what we want to try and achieve is extension in the upper back without losing it into the lower back. So you find your neutral spine, and then we're going to pull the upper back towards the floor. Shoulders active, so again, externally rotate and depress. Eyes looking down to the floor, head pushing back towards the ceiling. And we're just going to flex our hips and really trying to focus on that movement coming from the hip, not from the back. So as you go back, you don't want to round the lower back. And then as you come forward, so as you're extending your hips, you don't want to drop into extension. So we want to keep this position the same throughout the movement. So keep breathing. Forwards. Try not to lose your position. Let's do one more. Now come up into quadruped, and again we're going to find your neutral, get your upper back nice and flat, activate your shoulders, and we're just going to hinge backwards, again hinging the hip, so the hips flexing, there's no movement coming from the lower back, and forwards and back. Forwards and back. Forwards And now from this position, take 1 foot forwards into your tripod. And we're going to rotate up to the ceiling. And then rotate the other way. And down. Now pull that foot back and we're going to go back into this quadruped rock. And then pull the other foot forwards into the tripod and rotate. And then rotate the other way. Down. Bring that foot back, quadruped rock. Do the left side again. So take that left foot forwards, rotate. Down. Rotate the other way. Down. Bring that foot back, quadruped rock. Right foot forwards. Rotate. And back the other way. And bring that leg back. Now we're going to go up into bear. So you curl your back feet under. Keep your neutral. So find that again, upper back flat. Lift the knees. And we're just going to do some rocking, some hinging first. So again, the hinge, the movement's coming from the hip. And back. And hinge back. And forwards. Back. Forwards. And then you're going to go back. Take the left foot forward, so you're going to keep the back knee off the floor. And we're going to rotate up. Back down, pull it back. Hinge the bear. And now take the right foot forwards and rotate. So keep the back knee up. Back down. Bring that foot back. Lower the knees. Have a bit of a shake off. Bear's a bit more challenging. So now we're going to go back up into bear. Find your neutral, upper back flat, and we're going to hinge back, trying to make that movement come from the hip, not from the spine. Walk your hands backwards into your squat, come forwards a little bit. Try and be nice and upright with your squat so you're not rounded. And then you're just going to drop one knee to the floor and twist to the opposite direction, and then back into your squat, and then twist the other way. Try and be nice and upright again. Back into the squat, twist, back, twist. So as you go in, your foot should turn the same way as your knee. So take your foot with your knee and back up, down, one more each side. And now from your squat, you're going to stand and down and up. So when you're when you're standing and you're going down into the squat, try and make sure you've got your neutral spine. So don't start in this extended position or start in a slumped position. So find your pelvis and try and keep a neutral spine the whole way down. Up, down, up, down, up. Now stay up, and we're going to just do a roll down. So start from the head, tilt the head forwards, spine curving down towards the floor, and then back up. So again, peeling the spine, rolling it vertebrae by vertebrae. If you need to bend your knees as you're coming down, that's absolutely fine. And then you're going to walk your hands forwards and you're going to go into downward dog, and then take one leg forwards. So you're into this pigeon stretch. So you should be feeling the stretch in that left glute if it's your left foot, the leg that's forwards. And then you're just going to try and lift yourself up. So using that muscle, you're going to lift. Try not to let your body slouch, so be nice and upright again. And then lower down, so you're getting more of a stretch. Lift. Lower. One more. Lift. Lower. Pull that leg back into downward dog. And take the other leg forwards. Feel that stretch in the right glute. Shoulders active, up, spine nice and upright. And then you're going to push into the floor with the leg. Use the glute on the right to lift you up a little bit. And down. Lift. Down. One more. Lift. Down. Now bring that leg back into your downward dog. Back down into your bear. And now you want to pull that one leg through. You want to go up into your high kneeling. So I will come over here. Okay, so when you're in your high kneel, you don't want your front leg to be too narrow, so you pull it out to the side a little bit. You want your pelvis to be level with the floor, so you don't want to be in this like sort of diagonal appearance. So you're going to pull the pelvis down towards the floor so it's in line with it, it's a level. And then you want to make sure that your lower back is neutral, so you don't want to be starting like that or like that. So tilt your pelvis backwards and forwards, find neutral. Pelvis neutral. Think about your foot as well, so think about front and back, side to side, being fully connected with the floor. And then we're going to go from this position into standing, so curl the back foot under, and then we're going to stand and back down. When you're going up, try and make sure that the knee doesn't collapse in, and try and make sure that you don't just push your hip out to the side. So your body just wants to go straight up. So just really control the movements. And back down. And control it on the way back down as well. So make sure that the pelvis is level on the way back down as well. And come back a bit. So keep doing that movement, just trying to perfect this pelvis, making sure the knees tracking the second and third toe. And then stay down here. Imagine you've got your ball and you're going to pick your ball up, twist and go to the other side. And then go the other way. Do one more each side. So you're going to finish with the right foot forwards. I'm going to turn around here. Again, we're going to get the pelvis parallel with the floor, foot not too narrow, neutral spine, and then curl the back foot under, and again you're going to stand. Take that foot back, lower, control the movement. Let's do one more. Okay, so last little bit. Hope I don't fall over again because I'm going on one foot. So we're just gonna get the feet comfortably, sort of hip distance apart. And we're just gonna be flexing one leg up. So you wanna get your hip and your knee to 90 degrees, if you can. And really think about your pelvis. So what you don't want to do is let one side of your pelvis drop or twist round. So we're trying to keep the pelvis facing forwards and remaining parallel with the floor. So really connect with the floor, with the side that you're supporting on. And we're just going to lift and lower. Lift, lower, really focusing on what your pelvis is doing. Using my balance, need to work on this as well. Swap sides, do a few on the other side. So again, focus on the pelvis. So create your brace as well. So we're going to do some alternating. So one leg down, other leg down. It's amazing how hard this is. And then the last little bit, this is where it could go all wrong. We're going to take one leg up and then trying to keep the pelvis forwards, twist the leg out to the side and then back in. and down. Same on the other side. Up, out, back, down, lift up. So we're alternating. And back in, down, up. Seems to be more wobbly on my left side today. Do one more each side. Last one. Let's hope I don't fall. And down. So that's us done for today.